Hi, everyone, and thank you so much for tuning in to this episode of Mom Mode. This week we have Danielle Marple on the podcast, and I'm just super excited to have Danielle on. I've been following her journey from when she had her twin daughters to now having her son. And Danielle, I'm just so happy to have you on the podcast. Thanks so much for joining us.
Thank you so much for having me. I'm excited to be here and talk a little bit about my journey to motherhood and becoming a mom of three.
Yeah, congratulations.
Thank
Danielle just
you.
had a baby boy a little over
Yeah.
2.5 months ago, and he's joining us.
Special
For those who
guest.
don't know you, can you just give us a little bit, just a little intro into who you are?
Yeah. I'm Danielle. I'm 31. I have twin daughters who are 2 years old. And then this is David, our little son, who is 2.5. He was just born 2.5 months. He was just born in September. I am a nurse practitioner by day and then just love sharing. I love social media. So I just love sharing our story and just kind of like all the fun things about motherhood through kind of social media and Instagram, TikTok, things like that.
Yeah, which is how I came across your profile.
Oh.
And why I wanted Danielle to come on is with her two daughters, she actually developed preeclampsia and had them at 25 weeks.
25 weeks. Yeah.
So they were 25 weeks old when they were born. And then, obviously going through that trauma of birth, but then also getting pregnant with her son, David. I just wanted to talk about working through that next pregnancy and what that's like when you've had like a traumatic birth or just situation around pregnancy. Myself, I've had, my own trauma. I think moms all have their own little traumas that they might have experienced, whether it was
Mhm.
getting pregnant through pregnancy or birth. And so for you, what was your journey like getting pregnant with the girls? Was there any indication that preeclampsia would have been something that was going to be in your future with pregnancy potentially?
Yeah. So let me kind of like start from the beginning.
Yeah.
I actually have a genetic mutation called BRCA. I have a BRCA1 mutation. And my mom passed away of ovarian cancer when I was 7.
I'm so
And at
sorry.
the time, thank you. At the time, we didn't really know, like, genetic testing wasn't really a thing. We didn't really know about these BRCA mutations. You hear about it a lot with breast cancer. So when I was a little bit older, my gynecologist was like, I really think you should get tested and just see, like, knowledge is power. And at the time, I was kind of young. I was like early 20s. Sorry, we're battling illness in our house. So my eyes are tearing, my nose is running. Bear with me. But I didn't really have like much interest. And I had just started dating my husband, my now husband, who is an oncologist. And when we started dating, he's like, I really want you to get genetic testing done. Like, I think it's really important. So I went, I had genetic testing, found out I had this mutation. And basically, I'm at like an 85% lifetime risk for breast and ovarian cancer. Plus, with my family history of ovarian cancer, I'm at really, really high risk for developing these gynecologic cancers down the road. So my husband and I, who's my boyfriend at the time, we spent like over a year kind of doing our research, meeting with different specialists, kind of seeing what the best option for me would be. I was only 24 at the time. So I didn't want to do anything super dramatic like a hysterectomy, but I also didn't want to do nothing. So we kind of settled on a bilateral salpingectomy, which is removal of the fallopian tubes. And specifically with BRCA1 patients, that gives you about a 70% risk reduction in for cancer. So I was like, okay, I'm 24. I felt like this was doing something, but it wasn't really changing my life all too much. So I didn't have to do like egg freezing at the time. I kind of just went about my life. I didn't have to do any hormone replacement therapy. The only like trade off for doing the fallopian tube removal would be we would have to do IVF someday to grow our family. And I mean, I was pretty sure we were like, my husband and I were going to be moving into that, avenue of spending our lives together. So we kind of talked about it and we're like, yeah, this kind of sounds good. It's a good middle ground. So fast forward, that was in 2020. Fast forward, we get married in 22, and then we start the IVF process. I had my egg retrieval. We did genetic testing to they we I'm trying to like word this correctly. I want to use the term select out because that's technically what it was, but that sounds a little harsh. They used the healthiest genetic embryos first, so ones that didn't have the BRCA mutation.
Okay.
so that we wouldn't pass that then to our children. I think a common misconception is like breast cancer can only affect women, but it actually can affect men just as much. My husband, being an oncologist, sees it with men. So we knew for any of our children, we didn't want to pass that mutation on. So March of 2023, we did our first embryo transfer. So we did our embryo transfer in May of 2023. We were surprised about the gender. We didn't want to know what we were having. Which, with IVF, none of it is really a surprise. Like, yeah, you take a pregnancy test, yeah, you go for the ultrasound, but like none of it is like, oh my gosh, I missed my period. I could be pregnant. So um I'm a nurse practitioner in the ICU, so I have access to an ultrasound machine. And I was actually ultrasounding myself at work. And I was like, oh my gosh, before my like actual ultrasound. And I'm like, I think there's two. And I go home and I show the video to my husband. He's like, maybe. And then I was like really sick with like a virus one night. I ended up having to go to the emergency room for fluids. She stuck a probe on and she saw too. So like that was like a really big moment. And then when we went to our first like literal ultrasound, they were like, "Oh my gosh, yeah, you're having twins." So big surprise, but obviously IVF and twin pregnancy does put you at higher risk.
Mhm.
Um Ended up finding out we were having girls. And everything was pretty much status quo. The first like half of the pregnancy. I was followed by the high risk team just because it was a twin pregnancy. So they were doing a lot of my ultrasounds, and the girls were trending on the smaller side, but we were kind of chalking it up to it being twins. Um, One of the girls had what's called marginal cord insertion, so where the umbilical cord attached to the placenta was not in an ideal place. And then the other girl had a two vessel cord. So most umbilical cords have two arteries in one vein. She only had one artery in one vein. So they were like, these things typically can cause issues later in pregnancy. It's probably just a combination of factors, but we're just going to watch you. My husband and I take a trip to Paris. I was 22 weeks pregnant. It was like a baby moon / we were there for a wedding. And while I was there, my legs just like blew up like balloons. And we're like, okay, it's probably just from, traveling on the airplane. I didn't wear my compression socks long enough, like, whatever
Yep.
it was. Whole time we're there, I'm so swollen, doesn't get better. We come home on a Wednesday. I'm 22 and a half weeks pregnant. I have an MFM appointment for like a follow up scan the next day. So I'm like, okay, I'll just talk to them when I get there. The MFM doctor was like, I think it's probably just from travel. Let's just send off some labs to be sure. So Friday, I get some lab work done. And then my blood pressure was kind of trending higher. But again, it was like within normal range. So I'm like high for me, but still like 120s, 130s. Um, Fast forward to Sunday. I was checking my blood pressure at home. I was in the car on my way to my brother's, like still in the garage, but like going to my brother's baseball tournament. And I'm like, oh, let me just go back in the house and check my blood pressure quick. Like,
Mhm.
didn't feel still swollen, but like didn't feel any different than I had for days. I checked my blood pressure and it's 212 over 117
Oh
in
my
one arm.
gosh.
And I checked the other arm and it's like 197 over 102, like crazy numbers. And I show my
Mhm.
husband, he's like sitting at the computer doing work and he's like, that's not real. So I'm like, okay, I sit down on the couch because I felt no different.
Yep.
Sit down on the couch, lay down for 10 minutes, check it again, both arms, same thing. My stepmom comes over with my dad's blood pressure cuff, same thing, just as high. I call the doctor. I'm waiting for a call back and I'm like, I'm just going to like get my stuff together because I know they're going to tell me to come in. We start driving to the hospital. I develop this like very severe like epigastric pain, like almost like the worst heartburn you've ever felt in your life. As we're driving, now I'm crying because the pain is so bad.
Oh my gosh.
Our hospital was like 35 minutes away, but there's another hospital within the same system, like closer to our house. I tell my husband, I'm like, I'm not going to make it. Like, the pain is too bad. Like, you need to pull off in Venice. And as we're getting off the exit, the doctor calls me back and she's like, pull off the highway and get to the hospital, like, immediately. Like, she's like freaking out. Um, so we get there, same thing, blood pressure super high. They get my blood pressure down. I'm sure, did you have to have a mag drip?
I did, which I hated,
It was
but
awful.
I was gonna tell you, I can relate to the blood pressure because mine was 160 over 100, but literally was in shock. I'm like, "This can't be right." I felt the same
Exactly.
way. I'm like, "I
Yeah.
feel no different."
Yeah.
And then, yeah, as soon as I called my doctor and they got back to me, they're like, "Yep, you need to come to the hospital." And the mag drip was like the first thing that they did,
Awful.
which you
Wouldn't
feel
wish it on anybody.
so drowsy, just out of it.
Yep. It feels like you have the worst case of the flu. Like your insides are burning, but you're freezing cold and like you feel like you just have this horrible infection and yeah, it's horrible. You're so out of
Yeah.
it. So they transfer me to the main campus and then now I'm 23 and 0 at this point. So we're not even really at viability yet. So
Mhm.
then it just became like, how many days can we keep you pregnant for? Because like you're having some like, the baby's like, one baby was in a little bit of distress, like kind of intermittently. At this point, the measurements that we had had from the scan I had before I got admitted like a few days earlier showed them both in the like less than first percentile. So now we know my placenta's not working. Like for preeclampsia, your protein creatinine ratio has to be like over 300 to be classified as preeclampsia. Mine was over 10,000.
Wow.
And I'm 23 weeks. So it's not like I'm at a point where if I was 34, even probably 32, they would just say, like, okay, come on, we're going to deliver you. But at this point, it's like every minute counts staying pregnant just for their development.
Yeah.
So I get admitted. They end up, to make a very long story short, they end up keeping me pregnant for 25 weeks and 3 days. And then I started developing a lot of fluid in my abdomen. My liver was starting to shut down. And they said, like, it's time. Like, we had been teetering with blood pressure medications, like, literally trying everything to keep me pregnant just one day longer, one day longer. Um, and yeah, 25 and 3, had to deliver me. So it was an emergency C-section, but it was more like urgent. Like they had scanned me in the morning and then said like, "Okay, we're going to deliver you." That was like around 10:30 and they were born by 1:15 in the afternoon.
Wow.
Um so Adriana was our baby A. She was born at 1 pound 4 ounces.
Oh my
And
gosh, so little.
Sophia, baby B, she was the more growth restricted. She was 11 ounces.
11 ounces.
Yeah.
Oh my
Yep.
gosh.
Which is insane. Yeah, to think about now. I mean, now, it's Christmas time right now. You look at like the elf on the shelf. She was actually smaller than an elf on the shelf by weight and length.
Wow. So,
Yeah.
I
So I
mean,
think
this NICU team was just like incredible to
they were amazing. Yeah. They were a level 3 NICU. It's a hospital that my husband and I both work at. I'm a nurse practitioner. My husband's a physician. So I'm in the ICU there. He's an oncologist, but has privileges there. So we had full confidence in them. Um, and yeah, I mean, they just did an incredible job, like, especially in those beginning days, when literally just like touching them could literally like cause a brain bleed. And they were just phenomenal with how they truly cared for them and such care, so careful, and really got them through those like really tough moments.
how long were they in the NICU for?
So, a loaded question. Sophia was in for, um, 4.5 months.
Okay.
She was the smaller one. She kinda cruised through, like, she did as far as, like, NICU stays go, she did really well. Adriana, she was at our hospital for 3.5 months, and then she just, from a lung standpoint, was not getting any better. We were just kept having these setbacks and kind of ending up in the same position kind of over and over again. So they ended up having to transfer her to the main children's hospital, which was like an hour and a half ish away from our house. And she spent an additional 8 months there. So she was in for 344 days,
Wow. So were you
2 weeks
able to
shy of
bring
her
one home and not the
thing.
other?
Yes. Yeah. So Sophia came home after 4.5 months from that one hospital. So we had them in two different NICUs for about a month. And then once Sophia came home, Adriana was in for like another 8-ish months. And thank God they allowed me to bring Sophia with me to visit. I was there every single day. Um, but because Sophia was never a patient there, technically, like she wasn't supposed to be, but she was a twin. So they made it all work, thankfully. And I was able to bring her. I'm like, she's not two. Like, she's like, she's not full of germs. Like, she's just with me.
Yeah.
So thankfully that worked out. But it was a really, really rough road with Adriana. But literally, by the grace of God, ended up coming home after 11 and a half months, just on a little bit of oxygen at night, which was very quickly weaned off to nothing. She came home eating full bottles. Um, and now she's caught up on all her milestones. She's been home for a little over a year.
Oh my gosh,
Yeah,
that's
the only thing
incredible.
we're working on is walking. She
Yeah.
can walk. She's done it independently, but she's afraid. So, I mean, she walks she's holding on, no problem. She has her little push toy, she's running circles, but we're just, like, working on getting her up to speed with her sister, but, yeah, that's the only kinda thing that we're crossing off the list.
Yeah, and they each do that at their own time, and especially with all
Oh,
that
yeah.
you've been through.
Oh, yeah. I mean, 1 year in the NICU, born at 25 weeks, I'm like, "Take your time walking, you're good."
Yeah, seriously, it's just like a miracle that they're both here and that you're good.
Yeah.
How was recovery for you? So obviously like how your liver was kind of shutting down, you had the fluid buildup. I mean,
Mhm.
what was recovery like for you? Obviously you're worried about I'm sure you constantly have your daughters on your mind, but you
Yeah.
also had to like kind of find peace and heal yourself as well.
For sure. So, my recovery actually wasn't horrible. I think I did better than a lot of people expected me to. I ended up going home on one blood pressure medication, which because I'm a nurse practitioner, my OB was like, monitor your blood pressure. You can like wean it off yourself. So that's not typical, but I mean, I kind
Yeah.
of like took my own liberty with that. But yeah, I would say I was off meds within 2 weeks. The swelling had gone down after like 2 to 3 weeks. And then I recovered really well. I mean, my labs normalized pretty quickly. Um, Obviously I had a C-section recovery, which isn't the greatest, but because I didn't have two babies at home, I was really able to just like focus on rest. Obviously,
Yeah.
there was the whole added layer of stress with the girls, like you said. But because they were so small, I mean, we weren't doing a lot with them. They really just kind of like stayed in their little isolates. We didn't even get to hold them for over a month um, because of how fragile they were. So that kind of helped physical recovery. Mental
Mhm.
recovery, my husband and I are faith-based people. We're Christians, so we really just like leaned into our faith and just stayed in prayer about it and allowed God to just kind of lead the way,
Mhm.
which really, really carried us through. I mean, in that whole year in the NICU, I mean, our darkest days were literally like I don't know how we would have gotten through it if we didn't have our faith.
Yeah.
But yeah, that's really what totally got us got us through.
No, 100%, and I love that. With you, obviously, C-section recovery is definitely difficult. I had a C-section as well, and I'm just always amazed, like, obviously, the first moment of walking, taking your pants off to go to the bathroom is like you're like,
Yeah.
"How is this even possible? Like, what?" But then
Yeah,
you
major
do
surgery.
heal. Yeah,
Yeah.
but you do heal pretty quickly.
I think I'm a little bit of a unicorn. I mean, I have my one of my best friends is a labor and delivery nurse, and she's like, "Girl, something's wrong with you," because I didn't take one pain med for either of my C-sections.
Oh, wow.
And all my friends who had C-sections were like, "I couldn't walk. Like, what do you," and I was like up moving around. I got in trouble because I was like walking down to the NICU without a
Yeah.
wheelchair. So I did recover really well, which I know is not typical. So I don't want anyone like watching this to think like, "Oh yeah, you should just be able to like jump up and keep moving." I did recover from what I'm gathering, like, very easily compared to other people, so I was grateful for that too because I think we had a lot going on otherwise where
Yeah,
I'm like,
like
"Okay, physical recovery, like, thank you."
yeah, thanks for that
Yeah,
piece
that one
because
little piece of yeah.
I I would agree. I only took Tylenol and Motrin, but, like, I
Same,
took it,
yeah.
like, not wanting to feel the pain, but then I'm like, "I really don't think I need this."
Yeah.
But, yeah, I mean, I know some people have different experiences, but with you then having what was, like, your mindset of, like, after going through all that, you prayed, obviously, you had your faith, is that really what carried you through to being like, "I'm ready to have another one?"
Yeah, so we honestly I wanted to have another one sooner. I wanted them really close in age, and my husband was like, "We need Adriana to be home from the NICU and know that she's doing well before we can entertain this again." And which in hindsight was like fair because
Yeah.
um it was hard. I mean, when she first came home, she was on some meds, which thankfully we like got off all of them really quickly. But for a while, we were in PT twice a week, OT once a week, and speech and feeding once a week. So I mean, it was a full time job, plus like all her specialist appointments and all the things. So once we got settled, we knew that we wanted three kids, and I was committed to not letting what happened with our first pregnancy scare us into not doing it again, because every pregnancy is so different,
Mhm.
and once we lived it, I'm like, "Okay, we did this once, like, obviously, I wouldn't wanna do it again, but, like, I know we can do it, and I
Mhm.
just didn't want what we went through to interfere with what we had wanted for our family, so that's kind of what we leaned on, um, to kinda just, like, be like, "Okay, we can do this." So, once Adriana was home for a while, we started the IVF process. It was actually Christmas Eve of last year. I started my cycle, so we started meds and things like that, and my transfer was in February of last year, or this year rather. And yeah, so we went through the whole process, the whole IVF process again. We did know this time we were having a boy because we said whatever we had, we would just transfer like the opposite next time.
Mhm.
So, yeah, and honestly, like, I kept waiting for the other shoe to drop the whole pregnancy. Um, it was a hard pregnancy, like, symptom-wise, but I think overall health-wise, it wasn't horrible. I never got preeclampsia. There were a few times where I did go to the emergency room because I felt certain things or just, like, you know, I thought my blood pressure was creeping up or whatever, but like my OB said, like, I'd rather have you come in every single day and know that you have a healthy pregnancy than, have you be like, oh, it's probably fine. I'm just, have trauma from my last pregnancy and then, have something bad happen. Um, I had iron deficiency anemia in this pregnancy and I had to get an iron infusion at my husband's office. And I had, of course, an infusion um, reaction and like had to be treated the whole 9 yards. And then I'm like, the baby's not moving as much. I was like freaking out. My OB's like, just come
Mhm.
in. Like, let's just throw you on the monitor. So like things like that. Like she was just very, very supportive of like, I don't care. Like, just come in. Like, just, for your own peace of mind. Like, we've made it this far. Like, it's not worth it to, um, you know, be more stressed than you need to be. With him, I was having like a lot of prodromal labor, a lot of contractions, but nothing consistent. And a couple of times I did go in for contractions.
And
I
that
was
was
like,
toward, like, the end? Like,
yeah,
30,
I
like,
would say
5
like
weeks?
past 30, I would say like 31 weeks. I
Okay.
started with the contractions. Part of it was the stress of like, okay, I feel like once I hit 25 and 3, once I got to 25 and 4, I'm like, is what's gonna happen? When is this gonna happen? Because my girls were
Mhm.
born at 25 and 3. So yeah, once I got to, like, where I was with the girls, I started to kinda, like, freak out, and I think even now looking back on it, like, mentally, I don't think I could do another pregnancy again because of how bad my first pregnancy was, and I, like, powered through for the second one. Um,
Mhm.
Now looking back, I'm like, "I don't think I could do that again." Like, I was a mess. Um, and granted, like I said, we had our faith, like, carried us through, and I was like, "Okay," like, every day, just one day at a time, but it was hard for me, especially chasing 2 toddlers around,
Yep.
neither of which really walked at the time. It was just a lot. So, um, I would say like, yeah, 31, 32 weeks, I started with contractions. I would go to, for a while, I was like, I would say from 25 weeks, it was switching every single week. So I would see MFM one week and then my OB the next week. And then starting around 30 weeks, because I was a wreck, we had checked preeclampsia labs. And then, like, shortly after that, the, contractions were starting. I was seeing each of them once a week. So twice a week, I was getting seen, by a BPP, which is, like, checking for the integrity of the placenta. The MFM was doing that, and then my OB was just checking, like, fetal tones and then actually doing a cervical check too, just to see, like, and I was dilating a little bit. I was, like, a little bit effaced, like, things were happening, but not crazy. And
Yeah.
then
I feel
we
like with
just
that, with you having your girls so early, you really don't know how your body's gonna react to a
And
pregnancy
that's what we
going
kept
long.
saying. Yeah, we were like, "We don't know." Like, my OB kept saying, like, "Your uterus just doesn't know what to do with itself." Like,
Yeah.
it's crazy. So, yeah, I like at 35-ish weeks, she's like, "Let me see if I can convince MFM to let me deliver you," because, like, she's like, "I'm getting nervous. I don't want you to rupture, like, have, like, rupture of membranes and go into labor." Because the plan was always a C-section at 37. And then MFM was like, if she's not in active labor, like let her get to 36, which was like this happened on like a Friday and 36 was a Tuesday. So 36 weeks we go in and they open me up and my OB is like, oh my gosh. Like she just kept saying, oh my gosh, oh my gosh, oh my gosh. I'm like, what? Like we're like talking like over the sheet. And she's like, your uterus is so thin from all of the contractions. She's like, I can see his head. She's like, I have to literally cut so slowly because he's right there. She's like, if you had gone into labor, you would have had a uterine rupture. She's like, I'm so glad we delivered you today. Like, thank God you did not go into labor. She's like, if you went into labor, this would have been awful.
Oh my gosh.
So I had actually wanted to VBAC, and my OB and my husband were like, absolutely not. Like, you are the one person that something would go wrong with. And like, in the OR, like, that was an answered prayer. Like, God was saving us from something we didn't even know. Like, if I had VBAC'd or gone into labor naturally at home, like, it would have been a disaster.
Yeah.
Yep.
Yeah, so it's good that you were, I mean, monitoring that as closely. So, is that what happens is that when you're contracting, your uterus is literally thinning? Like, is that
Yeah.
pretty common?
So, I mean, your like cervix thins out, but I guess because like because I had gone into, I had had the girl so early and I had a C-section at 25 weeks, like, the
Yeah.
integrity of my uterus wasn't that great, so, with all the contracting, it was just, like, from the, C-section incision, it was just thinning out at that point, it was just, like, a weak spot, and
Okay.
that's where she was concerned that it would have ruptured, so.
So with this C-section, I mean, was this a totally different experience for you from when your girls? Because like with your girls, uh, I don't know if you felt fear, you didn't know how, if they were going to be okay. And with David, did you feel that like you were calmer during your C-section? Were you anxious? Like what were you feeling during it? Because I
Y
I had a C-section, but I didn't know I was having a C-section. Now, the second pregnancy, because of it, my doctor and we're kind of in agreement that I'm gonna have another once I get pregnant,
yeah.
and I'm just like, "What will it be like? Will I be nervous?" I mean, everyone's different, but what was your experience like walking in
Yeah,
knowing you were most likely, gonna have a C-section again?
so, it's funny because all my friends that I've talked to who had repeat sections were more nervous this time because
Okay.
they knew, like, I'm going into the operating room and, like, you kinda, like, anticipate the, like, sterility almost of it. You know what to expect versus, like, the last time you're like, "Oh, whatever, I'm having a C-section, like, I don't know what's going on."
Yeah, you're already
Um,
there, you're just like,
yeah,
"Okay, just get the baby out." Where
yeah,
now you're, like, walking into it.
yeah, I kinda felt the opposite. I was like, "Oh, I know what to expect," and also with the girls, there was, like, 40 people in the room because they had 2 separate NICU teams with the, like, neonatologists were there, like, there was just more people, um, plus, like, yeah, there was respiratory therapists, like, they each had their own team, and then because I was so sick, like, there was just a lot of hands on deck, whereas
Yeah,
this time it was more chill. There was the NICU team was there because I was less than 37 weeks, so because I was 36 weeks and he did end up going to the NICU, but it was only, the charge nurse who was, like, one of our, like, nurses that we adored when we were there the first time, and then one of the respiratory therapists that we adored. So, I mean, it was people that we knew.
mhm,
Um, yeah, and it was just, like, way more chill, like, my husband got to cut the cord, and, like, it was like, yes, he had some breathing issues going on, but they still, like, brought him over to me to see like, I got to take a picture with him, and, like, um, when my OB took him out, they, like, pulled the sheet down and, like, she was holding him for a bit and, like, held him up to me, and there's actually pictures of me just, like, bawling, like, looking at him.
oh,
Because with the girls, like, they did hold them up, but, like, they were born 30 seconds apart, like, it was very,
yeah,
very fast, so there's no pictures or anything, so it was a little bit more chill, I think, just because of how intense it was the first time. This time I
mhm,
felt better going into it.
yeah. Do you feel that, like, this pregnancy was somewhat healing for you? Or now, like yeah, like, I guess
Yes,
healing
I
or,
think
like
both. Yeah,
yeah,
like, healing and, like, I never wanna do that again.
'cause now
So
that adrenaline's worn off. I feel like you might have,
yeah.
like, had adrenaline, like, "Okay, let's just get this done."
Yeah, 100%. So healing in the sense that, like, I got to carry yes, he went to the NICU, but he still came home with us the day I got discharged. He was on breathing support for a few hours, like, it was very and again, our NICU experience, like, because of what we went through the first time, we knew everybody there when we were there with
Yeah,
David. We had all, like, our, auntie nurses, like, taking care of him. I'm like, "Oh, this is great. Like, I'm gonna go, like, get some sleep. Like, I'll be back down to visit him." Like, it just felt very comfortable. But just carrying a baby to almost term, um, was very healing and, like, knowing my body could do that. But in the same sense, like, I hated being pregnant. Like, I had horrible heartburn. My, like, the, like, preterm, like, the prodromal labor that was going on the whole time, chasing toddlers, like, it just wasn't for me, and, like, I am so grateful because I know, like, it is such a gift to be able to carry life and to be able to get pregnant, and, like, I don't take that for granted. Like, I know there's so many people who just wanna be pregnant and have a baby so badly, but to me, I'm like, this is a means to an end. Like, I just didn't love the pregnancy experience that some people have. So, um, healing, yes, but also like happy to close that chapter of my life too.
I get it. I so get
Yeah.
that because I tell my husband that I'm like, I mean, and maybe somebody can relate that would listen to this episode. Like, I have spent the last 2 years, like, obviously enjoying my daughter, but I had a lot of fear. I had a lot of trauma. I was like, I don't know if I want to have another baby. And then
Yeah.
my daughter like loves babies, and I'm like,
Yeah.
okay, wait, I have to give her a baby.
You
Like,
have to give this to
she
her.
can't be by herself.
Yeah.
And so I've like done all I could nutritional wise, working out, just trying to get myself in a totally different
Place.
realm of, yeah, like place, like physically, mentally, to hopefully have a different outcome with
Yeah.
another pregnancy. But yeah, I feel like I'm almost like, I don't know, once I have another baby, like maybe I'll feel what you feel as well with like, thank God that's behind us,
Yeah. Yep.
and like that's kind of, I feel like it's kind of sad. It's like great and sad at the same way because I'm trying to hopefully once getting pregnant, like enjoy it,
Yeah.
but you just never know. And it's so pregnancy and like carrying a baby is beautiful, but
Mhm.
there's so much to it. I mean,
There really is.
it's a
I
wild journey and everyone's is
Yeah.
different. Every single
Yep.
person's journey is different.
100%. And I talked this about, I mean, I connect with a lot of moms online, medical moms. I mean, I feel like I'm kind of like one toe in the medical mom community because of what we went through with Adriana, but now she's totally healthy. So I feel like I almost like I don't have a place there, but then like all the medical moms I know have kind of like, we're like, no, you're a part of us too. So,
Yeah.
but talking to them and like, especially moms of micro preemies, it's like, I think ignorance is bliss. Like people who have these like healthy, normal pregnancies and think that this is like the norm. And it is like 9 times out of 10, like probably 9.5 times out of 10, it is a beautiful experience. But um, I always say, like, be grateful that you haven't had to live through what some of us have had to live through because it changes things for future pregnancies and just the way you look at getting pregnant and your babies. I mean, I think it's given me such an appreciation for one, what our bodies are capable of, but like
Yeah.
two, just the life that I get to raise and have in the world. Like they are such a gift.
Yeah. No, it's so true. And even for me, I honestly like my like preeclampsia, obviously mine was late onset. So I didn't even
Mm,
have some of what you had gone through. Obviously I had the mag drip. I got postpartum preeclampsia, so I had to be on
yeah.
blood pressure meds for like 6 weeks.
Okay.
But it's made me kind of fearful, which I hate, but I'm working through it. But like of just life. Like you're just like,
Yeah.
here one day I thought I was so healthy. And then this pregnancy, you're like it's like so oblivious until it happens. And then you're like,
Yep.
oh my gosh, this just
Like you
happened
could have died.
overnight.
Yeah.
And like, yeah, I mean, you can die from it. This can
Yeah.
down your body. Like it's
Hmm.
just so wild. And I feel so
Yeah.
sad that there's not more research done around it
It's
of
crazy. We
how to
still don't
prevent it.
know. Yeah. I mean, if we like don't know what causes it, we don't. And again, every pregnancy is so different. Like I
Yeah.
got it the first time, but not the second time. Like, how does that happen? Like I was convinced I would have it again because of how bad it was the first time. So, I mean, and I think too, like your lived experience is your lived experience. Like don't underestimate just because you were late onset. Like it, like you have every right to feel all the feels that you're feeling,
Yeah.
regardless of when it happens.
Did your doctor have you do anything? Like I've heard baby aspirin
Yes.
is
Yeah.
something to take. So like was there anything that your doctor had you do differently to
Yeah. We
hopefully
did. We did a couple
not
of
get
things.
it?
So yeah, we did two things. A baby aspirin, which is some say like within the first trimester or at 12 weeks. My MFM, we had met with them beforehand too. They had said start 2 weeks before your IVF transfer. So I started that, and then also Plaquenil, which is a medication that's used for a lot of autoimmune disorders. We don't know if I have an autoimmune disorder. My mom did. She had antiphospholipid syndrome, which is basically in pregnancy. It basically like throws clots into the umbilical cord. So my mom actually had a bunch of miscarriages before getting pregnant with me, and then with me had a really tough pregnancy, like bed rest and Lovenox shots, like blood thinners and things. Um, so I had like one lab that kind of came back like a little bit elevated, but there was nothing glaring. But we're like, it's a benign medication. Let's just put you on it. So I started both of those 2 weeks before. Um, my IVF transfer, was on it throughout the whole pregnancy. We stopped the aspirin at 33 weeks because I was nervous I was going to deliver at 34 because of all the contractions. So we stopped the aspirin at 34 and then the Plaquenil the day of delivery. Like I think the night before was like the last time I took it. And so we were like, okay, maybe I had something. So the thought was with the autoimmune stuff that maybe I had an autoimmune that we didn't know about that flared
Mhm.
in my first pregnancy. And the problem with autoimmune is unless you know what you're looking for, it's really hard to pinpoint something because I don't have any symptoms. So if you don't
Yep.
know, if you're not drawing labs or looking for things based off symptoms, you really can't. It's so hard to find. It's like a needle in a haystack. So that worked for me. I mean, we're assuming that that definitely contributed to, my success, but we don't know for sure.
Yeah, I've heard the baby aspirin, but I haven't heard about the autoimmune.
Yeah.
Um, yeah, autoimmune is just so tricky. Yeah, I got some like extra blood labs drawn because I was like, okay, I just want to do anything and everything. Like knowledge is
Yeah.
power. And so I went and had like all these extra labs drawn that they normally wouldn't draw.
Hmm.
And mine did. There was like one test that they could draw that like triggers if you have something autoimmune, but they don't know what. And it triggered.
Yeah. Yep. It was probably your ANA.
Yeah, my
Yep.
ANA.
Yep. And
So then they were like,
yours was
well,
positive.
yes, mine was
Yep.
positive.
Mine was as well. But again, that could mean anything. And again, like
Anything.
I think too, like with my husband and I having medical backgrounds, like we ask questions, like we just kind of look at things through different lenses. Um, and again, like I think with this autoimmune, like an ANA, like it could literally mean anything. So it's like
Yep.
when talking to my OB, my IVF doctor, and my MFM, we kind of all got together and we're like, might as well just treat you like you have an autoimmune disease in pregnancy and then like hope that that helps. So I mean, that might be something for you to talk to your OB about too, is Plaquenil, because it is a benign,
Is
yeah,
that just like help if you were like
in
help
a flare.
a flare not happen or
Yeah.
something?
Yep, yep. Yeah, so I
Wow.
don't know the whole mechanism behind it,
Yeah.
but yeah, I mean, I have friends that take it that like, I have a friend with rheumatoid arthritis who takes it. I'd have to look and see, like, the actual, like, pathophysiology behind it, but, it's safe for the baby, it's safe in pregnancy. So, I mean, that might be something to consider if you had a positive ANA. And
Yeah,
again,
that
you're kind of
is.
guessing, like, you're not and it wasn't like, "This
1000%.
will work," but, I mean, we're like,
Yeah.
"Let's try it."
Yeah, because also, like, I mean, like you said, IVF is a reason why you could have preeclampsia, but also like
Mhm.
first time pregnancies. It's just
Yeah.
so common, which
Yeah.
is what my MFM said. She's like, well, the good thing is, next pregnancy would be your second. You have the same partner. Like, your body's already been used to that. Um,
Mhm.
so yeah, I mean, you just have to pray for, a more positive outcome. But like you mentioned, you went through it. So if it happened with David, you were ready to power through it again.
Yeah. Grateful it did not happen, though.
Yes, no, definitely. So with, moving forward, um, what advice can you give to any mom? So obviously we're talking about preeclampsia, but there's, like I said, there's just so much, just different things that can happen to a mom, whether that's
Yeah.
throughout trying to get pregnant, pregnancy, birth. What advice can you give to a mom, that's like really hesitating getting pregnant again because of fear?
Yeah, I would say, this is, like, something general that someone had told me more so about, like, in the thick of it with young kids, but I think it applies to this too. Like, don't think of your life right now, think about what you want your table to look like in 10 years. And
Mhm.
we knew that we had a vision for our family, and our family did not feel complete after the girls, and obviously we love them and adore them, but I think, communicate with your doctors, find a community that you can connect with. Like for me, it's social media. I mean, I connect with so many different people, hear different stories. I'm on like some different groups. And again, for us, we're faith based people. So like our being in prayer and really feeling led that we wanted to grow our family. But whatever it is for you, if it's not church, if it's whatever it is, find what gives you that like grounded peace feeling, move forward in that and know that like if you did something once, you can do it again. And for some people, it is like they're like, you know what? I don't want to live through that again, and they're done. And I think that's okay too. But if you are feeling hesitant and don't feel like your family's complete, like every pregnancy is so different. I think that's important to remember. Stay in contact with your doctors. And just think about what you want life to look like in 10 years, not right now. And if like for us, if our doctors didn't, had said like it's not safe for you to get pregnant again, we wouldn't have done it. But they were on board and I think that helped too. So yeah, I mean, do your homework, find what works for you to help get you grounded and in the right mindset. And then I would say just go for it. I mean, yes, it's hard. And like, I don't want to say that mentally I didn't struggle because I did, but holding my baby, 100% worth it. And I would do it again in a heartbeat. Just getting to like get that complete family.
Yeah, and he's so beautiful. Oh my gosh, just, like, seeing him just lay there like a little doll is just
Thank
the
you.
sweetest. Well,
He is the sweetest and his big sisters love him.
oh my gosh. So do you just feel, like, so complete now? Like, just having all of you at home? And, like, what do you think's, like,
Yeah.
next for you guys?
So what's next for us? I think, yeah, just enjoying being a family of 5. Um, just like getting to watch them grow up. I mean, our girls are 2 now. They were 25 weekers and they had a rough course. So I mean, they're a little bit more like less than 2, I would say, development wise, but right there. And just like watching them explode in their skills and speech and just like be adventurous and like learn new things every day has been so much fun. Watching them interact with him and watch him grow and change. I've never had a baby grow before. I mean, my girls are so
Mhm.
tiny still to this day. So it's like so fun just getting to experience life with kids. And now too, just like with Christmas being here and just like watching the magic through their eyes, like we are just loving life with 3. um Now granted, a lot of days I want to rip my hair out like right before nap time before I got on this call with you. But it is such a gift having them and we are so grateful for our family. So I think just yeah, enjoying life and traveling. And we live in Southwest Florida, so the weather's always nice here and just like doing fun things with them. Um, yeah, and just pure joy, pure joy.
Yeah. Well, I'm so happy for you for seeing this little boy. I was like following obviously your pregnancy the whole time, like
Yeah,
how are you doing? Looking for your updates. Obviously, I enjoy everything that you share and I'm like so thankful for what you do share on social media
thank
and
you. I
just
try to be an
happy to
open
have had
book.
you.
Yeah, happy to
Yeah.
be here. Thank you so much for letting me share a small piece of our story.
Yeah. No, I've loved it and thank you so much for coming on the podcast.
Thank you. Thank you for having me.